Hello, everybody. Welcome to another edition of the Michael Costa Show. It will be another COVID update because today there are rumors that Premier Legault, with the changing of the hour, that he will today in a press conference prolong the curfew from 8 o'clock to 9 or 9:30 p.m. That is just basically giving us a little treat to try to keep us obeying the rest of the power-hungry measures of this pandemic. Like I've showed you in previous COVID updates, we see many side effects of the measures, of the government measures, and the collateral damage it is doing to proponents of the population that far outreach the people that are in danger of the virus being very severe or bringing very severe illness to them. So basically, when this is all over, because I don't know, for some reason the opposition doesn't want to look into this when it's their job to, but when this is all over, we will see the rampant effect that it's had on the population in general. In this article posted on Western Standard, titled "Stats Show Deaths from Delayed Medical Procedures, Increased Substance Use, Exceed Deaths from COVID-19. As provincial public health measures and lockdowns ramped up in the fall, the number of excess deaths exceeds the number of deaths directly due to COVID-19. Says everything right there. As provincial public health measures and lockdowns ramped up in the fall, the number of excess deaths exceeds the number of deaths directly due to COVID-19. COVID-19 continues to affect communities and families across the country, and many have lost family members and friends. Beyond deaths attributed to the disease itself, the pandemic procured indirect consequences that increased the number of deaths from various factors, including delayed medical procedures or increased substance use. Measuring excess mortality, which occurs when there are more deaths during a period than what would be expected for that period, may be the best gauge the indirect consequences of the pandemic and pandemic response. From January to mid-December 2020, there were an estimated 296,373 deaths in Canada, representing an excess of 13,798 deaths, exceeding the expected range had there been no pandemic. In the early months of the pandemic, Statistics Canada notes the number of excess deaths and deaths caused by COVID-19 were closely aligned and mainly affected older populations, suggesting COVID-19 itself was driving excess mortality in Canada. From March to early June, there were 8,530 deaths where COVID-19 was the underlying cause. Based on the medical certificate of cause of death, exceeding the number of excess deaths, 8,496, by under 1% over that period, the stats show. Overall, during those first months of the pandemic, 86% of excess deaths occurred among individuals aged 65 and older. Similarly, COVID-19 deaths also disproportionality occurred in older populations during the March to early June period. Approximately 94% of deaths caused by COVID-19 involved individuals aged 65 or older. On the biggest lesson learned from the federal government's handling of COVID-19, Chief Public Health Officer Dr. Teresa Tam said, "We failed the most vulnerable." I think the tragedy and the massive lesson learned for everyone in Canada is that they were at every level not able to protect our seniors, particularly those in long-term care homes. especially here in Quebec, where at the beginning of the pandemic and for months, we put back sick people back into nursing homes, back into communities of vulnerable people to the COVID-19 disease. Just like they're investigating Governor Cuomo and the governor of Michigan for causing the death of thousands of people by using this policy that Quebec has used, but for some reason, media here in Quebec haven't pointed that out, unless maybe at the beginning a bit, but since then, haven't pointed that out, that many of the deaths, most of them in long-term care facilities, where the population is a bit older, by putting back sick people back into the homes instead of quarantining them at the hospital at the hospital, by putting them back in those long-term care facilities, it contaminated and killed thousands of people. Even worse is that in the second wave, as we warned of the resurgence, there was a repeat of the huge impact on that population. However, as provincial public health measures and lockdowns ramped up in the fall, the number of excess deaths exceeds the number of deaths directly due to COVID-19. The cause of death has been reported for 94% of the deaths during the first period of excess mortality in Canada, from March to June. From February to November, 3,626 excess deaths were reported nationally. There were 1,835 deaths reported caused directly by COVID-19, with the number expected to rise as more deaths are reported by the provinces and territories, the stats show. Excuse me. Younger people were more affected by excess deaths because 35% of these deaths involved individuals under the age of 65, up from 14% in the spring. Failing to acknowledge the indirect consequences of the federal government's COVID-19 response, she repeated her previous remarks as their failure to protect vulnerable Albertans will be forever etched in our collective memory. Not just seniors, racialized populations, women, and people in congregate housing, so that is the biggest lesson learned for sure, she said. The deaths related to the indirect consequences of COVID-19 predominantly affect younger populations, suggesting that other factors are now at play. Like observations in the spring, about 95% of the deaths directly caused by COVID-19 during the fall involved people aged 65 and older. The number of deaths was 24% higher than expected for men aged under 45, followed by women aged 45 to 64, who recorded 14% more deaths than anticipated. By comparison, there were 6% more deaths than expected among those aged 85 and older during the fall period. As these shifts imply an increase in deaths not directly caused by COVID-19, it is essential to note that some deaths may be due to the pandemic's indirect consequences, including increases in mortality due to overdoses. For example, in British Columbia, the Chief Coroner's Office reported increases in deaths due to overdoses since the start of the pandemic. Similarly, Alberta Health Services reported decreases in both the provision and use of substance use treatment programs and increase in opioid-related emergency responses and deaths since the onset of the pandemic. Overdose deaths disproportionately affect younger men. For example, according to a report by Alberta Health between January 1st and January 30th, 2020, 79% of apparent unintentional fentanyl overdoses were among men, with those aged 25 to 39 recording the highest proportions of such deaths. Increased excess mortality in Alberta and British Columbia partly accounted for the shift. In the fall, there were 12% more deaths than expected in Alberta, up from 5% more deaths than anticipated in the spring. Similarly, for British Columbia, there were 9% more deaths than expected in the fall, compared with 6% in the spring. While overdose deaths across Canada appeared to decline in 2019 from highs in 2017 and 18, there are early signs of an increase in 2020. For example, Alberta reported 220 deaths caused by overdoses from March to June 2020, compared with only 170 overdose deaths during the same period in 2019. The share of excess deaths for Ontario was relatively similar in the spring, 39%, and fall, 40%. Based on data received to date, from March to June, the number of deaths from specific causes rose in several provinces compared with the same period in previous years. For example, the number of deaths caused by heart disease in Ontario increased from 4,125 in the spring of 2019 to 4,345 in the spring of 2020, higher than the spring of the previous 5 years. So this article shows you more of the collateral damage that government measures are causing to the population in general. Or like the video of the father I saw on Facebook crying his eyes out because his 6-year-old son that will live his second birthday since the pandemic started, alone, with no friends, asking his father if he thinks life is good and that he doesn't like life. It's sad that we are sacrificing an entire generation because of a hard-headedness to continue with measures that do not work and put a bigger part of the generation at risk from other side effects to the measures implemented by the government. Let me show you more evidence of why lockdowns don't work. Because we've been in this pandemic for a year. So we can look at jurisdictions that had strict lockdowns and others that didn't. And we can compare. So, according to the Associated Press, virus tolls similar despite governors contrasting actions. Nearly a year after California Governor Gavin Newsom ordered the nation's first statewide shutdown because of the coronavirus, masks remain mandated. Indoor dining and outdoor activities are significantly limited, and Disneyland remains closed. By contrast, Florida has no statewide restrictions. Republican Governor Ron DeSantis has prohibited municipalities from fining people who refuse to wear masks, and Disney World has been open since July. Despite their differing approaches, California and Florida have experienced almost identical outcomes in COVID-19 case rates. How have two states that took such divergent tacks arrived at similar points? This is going to be an important question that we have to ask ourselves. What public health measures actually were the most impactful, and which ones had negligible effect or backfired by driving behavior underground? Said Amish Adalja, a senior scholar at the Johns Hopkins Center for Health Security. Though research has found that mask mandates and limits on group activities such as indoor dining can help slow the spread of the coronavirus, states with greater government-imposed restrictions have not always fared better than those without them. California and Florida both have a COVID-19 case rate of around 8,900 per 100,000 residents since the pandemic began. According to the Federal Centers for Disease Control and Prevention, and both ranked in the middle among states for COVID-19 death rates. Florida was 27th. As of Friday, California was 28th. So Connecticut and South Dakota are another example. Both rank among the 10 worst states for COVID-19 death rates. Yet Connecticut, Governor Ned Lamont, a Democrat, imposed numerous statewide restrictions over the past year after an early surge in deaths, while South Dakota Governor Kristi Noem, a Republican, issued no mandates as virus deaths soared in the fall. While Lamont ordered quarantines for certain out-of-state visitors, Noem launched a $5 million tourism advertising campaign and welcomed people to a massive motorcycle rally, which some health experts say spread the coronavirus throughout the Midwest. Both contend their approach is the best. Even in the pandemic, public health policy needs to take into account people's economic and social well-being. Well said. Noam said during a recent conservative convention. Lamont recently announced that he is lifting capacity limits at retail stores, restaurants, and other facilities effective March 19th, but bars that don't serve food will remain closed and a mask mandate will continue. This is not Texas. This is not Mississippi. This is Connecticut, Lamont said, referencing other states that recently lifted mask mandates. We're finding what works is wearing the mask, social distancing, and vaccinations, he said. As new COVID-19 cases decrease nationally, governors in more than half the states have taken actions during the past 2 weeks to end or ease coronavirus restrictions. According to an Associated Press tally, some capacity limits ended Friday in Maryland and Oklahoma. Michigan, Minnesota, New Jersey, New York, and Wyoming are relaxing restrictions in the coming week. In almost all cases, governors have lauded their approach to the pandemic, while critics have accused them of being too stringent or too lax. It's all politics, folks. If one state has similar numbers related to COVID deaths and cases than another state that has completely different government measures to control the spread, then we can say that those measures are not what is dictating the spread of the virus. We found in studies that population density, could be a driving force of the spread. So more people are on top of each other, the more the virus will spread, which seems logical to me. No matter of the measures. And like in this article states, that maybe in some cases that government measures, strict government lockdown measures, have brought people to the underground. And thus, like I've said many times, when you're in the underground, you don't follow the rules. You don't wear the mask. You don't try to keep your 2-meter distance. So there's more risk of the virus spreading. Whereas if lockdowns weren't in effect, and these places where public places where people go to socialize, they would enforce these measures, the mask wearing and the social distancing, and thus would limit the spread of the virus. Now, I'm not saying we don't listen to the measures and that we are still gathering, even though the government measures prohibit it, but it does happen. Anybody with a bit of a brain will understand that some people will not care and continue to socialize. California's slow reopening is expected to gain steam in April, but Republicans in California are helping organize a recall effort against Newsom that has drawn nearly 2 million petition signatures from people frustrated over his long-lasting limits on businesses, church gatherings, and people's activities. He also faces intense pressure over public school closures and the glacial pace of getting them reopened. In his own State of the State address, DeSantis asserted that Florida was in better shape than others because its businesses and schools are open. Florida's unemployment rate ranked below the national average and significantly lower than California at the start of this year. While so many other states kept locking people down over these many months, Florida lifted people up, DeSantis said. Determining which approach is best is more complicated than just looking at statewide policies and overall case rates. Obviously, but it's worth looking into. Like Florida, Missouri had no statewide mask mandate, ended business restrictions last June, and has a cumulative COVID-19 death rate similar to California's. In the absence of statewide orders, many of the largest cities in Florida and Missouri imposed their own mask requirements and business restrictions. In Missouri, that meant about half the population was still subject to mask mandates. So here the Associated Press shows you that with the example of states that have severe lockdowns and others that don't, that the cases are similar in both in these states. So, like studies that have come out that show that lockdowns do not work to stop the spread of this virus, I repeat, it is time for our government to reevaluate their strategy. I implore our government, Premier Legault, to reevaluate his strategy. Talk to us like adults and not children, like you do in your press conferences. Reopen everything, but ask us to stay vigilant, wear the masks, continue social distancing, wash your hands. If you talk to us like adults, we will listen. Governor DeSantis, in my opinion, is the governor that has come out in this pandemic as the one with the biggest courage to save his population and its businesses from collapse. And this is another good movie he made. In an Orlando news site, Governor DeSantis overturns COVID-19 fines against businesses. Order applies to any fines imposed between March 1st, 2020 and March 10th, 2021. He will save these businesses thousands of dollars. And that's what he should do. Because when you govern for everybody, not for a percentage of the population. You must take in consideration everybody, even the vulnerable, even the less vulnerable. But then you make decisions considering everybody. That's what being a governor, prime minister, premier, or president is all about. In the Star Tribune, COVID masks for young athletes are worse than useless. There is no science backing up the effectiveness of masks once soaked with sweat, and they pose a risk of serious injury during play. On January 4th, sports from the youth to the high school level were scheduled to resume under new regulations from Minnesota Department of Health. According to these new rules, all athletes must wear face coverings while competing in their sports, which exceptions given to wrestling, swimming, cheerleading, and gymnastics. I have concerns with these rules as I see them posing undue hazards to our young athletes. I am a former multi-sport high school athlete and collegiate basketball player. I graduated from Princeton University with a degree in molecular biology and virology, and now serve as an orthopedic sports medicine surgeon. I fear that the requirement for athletes to wear face masks during competition is unsafe, unrealistic, and likely ineffective. The close personal contact of a wrestling match makes wrestling among the most likely of sports to spread COVID-19. Yet, under new rules, face coverings are not encouraged during wrestling competition due to obvious safety concerns. Does anyone else see the paradox? The reality is that the face covering should not be considered safe for any athlete to wear during a competition. Clear. And this is written by Andrew F. Arthur, which he just told you his credentials. So this is not any jabroni on YouTube. This is a guy with degrees, a scientist, telling you masks during when athletes are playing their sports is dangerous and useless. Now, I found an article in The Novelist, which is a French newspaper based in Three Rivers, or Trois-Rivières, if you will. And since it was in French, I translated using Google Translate. So bear with me if the translation is not perfect, but I'll read you the article. So, basically, it was how governments use fear to advance their COVID-19 strategy. Science in its words. Fear is inseparable from who we are. As a primary emotion, it has its uses because it sometimes allows us to survive or escape danger. The emotion is also useful in communication, in addition to playing an undeniable political role. The pandemic, which has now lasted for a year, brings out these two sides of the same coin. By the way, who wrote this article was a marketing expert. Because fear has been a privileged instrument in the political management of the pandemic. The language of the authorities, appealing to strong images of confinement, curfews, roadblocks, police patrols, deserted city centers, masks, and daily deaths, could lead to this obedience that was sought after. Add to that the threat of variants these days. This hypothesis deserves to be verified, as does the role of the media, major players, and important news amplifiers. As a professor of marketing and communication marketing at the School of Management of the University of Quebec in Three Rivers, the undersides of our behavior particularly concern me. What are the motivations pushing us to adopt such or such behavior? What mechanisms have led the population to obey the health rules decreed by the authorities? Fear, a political tool that goes back a long way. Going back in time, we understand the importance of fear. Greek historian Thucydides described the reality of the wars that threatened Greek cities over 2,000 years ago. Fear has first of all political role in the relations between rulers and ruled. It is the cause that drives action. Centuries later, Thomas Hobbes, the English philosopher, argues that it is the state that sometimes identifies an object, a threat to be wary of, to be afraid of, especially when at first glance the population pays more or less attention to it. For Hobbes, fear also plays a positive role, as it enables authority, the ruler, to govern and maintain order by fueling fear of sanctions. It's exactly what our government is doing. Nicholas Machiavelli, for his part, will argue that it is safer to be feared than to be loved. Powerful, right there. It is safer to be feared than to be loved. To govern is to put your subjects out of harm's way and even to think about it. In the 19th century, Alexis de Tocqueville embarked on a journey to the United States, which also took him to Canada, Quebec and Montreal in particular. He observes the nascent democracy and draws some conclusions that are still echoed today. Without directly addressing fear, he mentions that henceforth the people will no longer be led by a tyrant, but rather by a guardian. A milder despotism, in short. While we seem to live with a certain recklessness, the power is watching over us. In this famous essay on democracy in America, Tocqueville writes that power might resemble paternal power if, like it was intended to prepare men for the manly age. But on the contrary, it only seeks to fix them irrevocably in childhood. Today, fear still calls out. The American political scientist Corey Robin also devoted a book in 2004. He summarizes the process, recalling Hobbes. The authorities identify an object of which the public must be afraid in order to then explain its dangerousness. In light of these few aspects, can we argue that fear has been an asset of governments in managing the current crisis? Did she allow people to obey? Has the paternalism of which Tocqueville speaks made the task of the authorities easier? That's exactly what I was telling you about earlier. And how Legault has to stop talking to his constituents as they were all children and start treating them as adults in full transparency. Fear in moderate doses. Communication advertising in particular often has an ambitious goal to change behavior. Over time, we have seen campaigns that try to make us aware of public health issues related to wearing seatbelts, the dangers of tobacco, AIDS, or alcohol and drug abuse. Often these messages were based on fear, so that the use of this emotion has often been studied. As is always the case in advertising, the area is gray. It is difficult, if not impossible, to establish a recipe that directly leads to the effectiveness and impact sought. The meta-analysis study conducted in 2015 sheds light on the effectiveness of fear. First, it seems that a moderate representation of fear is effective and that there is no need to add it. A moderate message may be sufficient and deliver that expected impact. The form of the message is also important. If he mentions a high level of severity, or the likelihood of the worst happening, he is more likely to work. 1 in 14 women destined to develop breast cancer in her lifetime. So every woman can get breast cancer. You also run this risk. So basically, what he's showing, and if you want to go look up the article, it's in the Novelist from yesterday, if I'm not mistaken, or at worst Sunday, but I think it's from Monday, where he shows how the strategy of fear helps for people to obey these government measures by instilling fear in the weak-minded that cannot see past this fear. And I understand if these people just open the TV and just look all the time 24/7 at the news, then yes, they're likely to be afraid. But I suggest they look up articles, studies, look into these things, compare with other jurisdictions, and see for yourself. We must all fight the spread of this virus, but we must do it effectively and not by destroying. You're saving one part of the population by destroying another part of the population. That's not how you govern. And maybe after a year, it's time we ask these questions. And it's also time for Premier Legault to be transparent. Stop reprogramming this sanitary emergency every 10 days by executive order, because that is illegal according to the public health law. You got to bring it to a vote in Parliament, and the opposition has to start doing their job, and he must start being transparent with his population and stop treating them as children, but treat them as responsible adults and let them make their decisions knowing all the factors. This is what I ask of Premier Legault. All right, guys. Thanks for tuning in to the Michael Costa Show. Hope to see you soon. Peace out.